Right, welcome everyone. I'm Naomi. I'm the Learning and Development Programme Lead here at PICA, and this week is National Co-Production Week. So it's a week to highlight the value of working in partnership with people who use health and care services. Our vision at PICA is the highest quality person-centred care for all, always, and we know how crucial the voices of patients and service users are to making that vision a reality. So we thought we would take a moment during co-production week to showcase what co-production can look like in practice and the impact it can have on both staff and service users. So I am delighted today to be joined for this conversation by two guests, both of whom have inspired me personally with their passion for the work that they do and their commitment to co-design and co-production. So a really warm welcome to both of you. Juliet, do you want to introduce yourself first?
My name is Juliet Rayment. I'm a sociologist by background. I work as a researcher, historically mostly on the maternity services in the UK, and I think I'm probably going to talk to you a little bit more about that during the podcast. But at the moment, I work as a research fellow at the University of Surrey on a large project, a collaborative project between the NHS and academics to try and improve NHS staff wellbeing.
Amazing, thank you. And Sinead.
Hi, thanks so much for having me. So I'm Sinead. I'm the clinical lead of a speech therapy team here in London at a cancer specialist hospital. And my role at the moment is a bit of a mix of clinical and kind of research, but I work a lot with people who have had head and neck cancer. And I've done quite a bit of work now around how we improve some of the pathways for people who are sort of having and had treatment. And I was really interested in using co-design and co-production within that. So I'm really delighted to talk to you a bit more about that today.
Brilliant, thank you both. I should say before we get going that we teach at PICA a particular person-centered improvement method called experience-based co-design, or EBCD. So we'll be using the term co-design as well as co-production in our conversation today. And in healthcare, the terms co-design and co-production are often used interchangeably, and people will define them slightly differently. So we actually don't get too hung up at PICA on the difference between co-design and co-production. We're much more interested in that co-part of the words. So whether there is a genuine willingness to share power between people who provide services and people who use those services, and whether patients and service users are involved in a meaningful rather than tokenistic way. We've probably all filled out a survey at one time or another about our care. I did one, in fact, just last week. And then we wonder if anything will actually happen as a result of the feedback we've just given. It can be quite a disempowering feeling sharing your experience and then having literally no control over what happens next. Co-design and co-production, though, are different. There shouldn't be any doing to or doing for the people who use services. This is about designing and improving care with the people who use those services. And so we're looking forward to bringing that to life a little bit today by hearing what it looked like in practice for you, Sinead and Juliet. So first of all, Sinead, tell us a bit about what you do, and in the context of your work, why and how did you use co-production?
Yeah, I'd love to. So as I mentioned, I'm a speech and language therapist, and I work particularly in the area of head and neck cancer. Head and neck cancer and people who have had treatment for it, whilst there's been loads of improvements within the focus on early diagnostic pathways, so trying to diagnose cancers earlier and treat them with lots of improving technologies, and that's things like radiotherapy and chemotherapy, and lots of people now have heard about things like immunotherapy as well. So there's loads of improvements in the way that we can treat head and neck cancer. What we also know that is, whilst more people are surviving head and neck cancer, they are still left with profound and significant issues which relate to their quality of life after treatment. So I am particularly interested in the swallowing problems that lots of patients have. And if you think about your head and neck, so your mouth and your throat and the jobs that those areas do, if you've had treatment in those areas, you're often expected to have some difficulties after your treatment finishes, which can have an impact on how you eat and drink, and then the knock-on kind of socially and the impact on your quality of life and your function after treatment. So I'm kind of really, so I was really sort of interested in the idea that, yes, brilliant that we've got better treatments out there and we're really engaging with getting people diagnosed earlier, but actually let's not forget about this other part of the pathway, which is kind of around living well after your treatment and in terms of sort of survivorship issues. And what I was really interested in doing is about how we can get people who have been through treatment more involved in how we think about our services and designing our services and evaluating our services. And I think my experience as a clinician working was that we often made assumptions about what we thought people had experienced in their treatment. So whether that's from when we first met them, through treatment, or afterwards, we would kind of say what we thought they were finding more difficult, or how they might be finding eating and drinking or swallowing afterwards, based on some of the clinical assessments that we do. But we didn't really talk to people about that experiences and how their own experiences could shape the kind of care that we provide them. So when I heard about the work that is done through, and you mentioned EBCD already, Naomi, when I heard about that kind of way of looking at somebody's experiences and using that to kind of utilize and improve care pathways, I was really interested in being able to try and do that a bit more in the work that I do.
Fantastic. And what would you say improved for people through that process? How did it work, and what difference do you think it made?
So I think there was so many kind of differences that it made, and we got a lot of really amazing feedback. And I would say with and I'm sure we'll talk about this a bit more with EBCD, it wasn't just the people who had treatment we spoke to, it was also staff that were engaged in the process, so not just speech therapists but other members of our multidisciplinary team. But in terms of what people kind of got from it, there was so much, firstly, as somebody working in the area, that I got from it, and I know from the other teams who were involved got from it as well. There was this real understanding, actually, that the way that we view and see our pathways isn't the same as the way that sometimes people who are having treatment experience and view them. So, for example, one of the things that really came out for me was we often, and I've kind of done it here even as I've been speaking, we often think about our pathways as being quite set in terms of before someone's being diagnosed, when they're diagnosed, when they're having their treatment, and after their treatment finishes. But actually what we were told by people who experience treatment is that that's a continuum for them. They go into, and even if they get seen by different hospitals, they might have their diagnosis in one place and they might then get seen somewhere else. As someone experiencing that, they've been diagnosed with a cancer and then they are on that continuum of care. And actually thinking about that in a different way really made us evaluate how we're providing resources and information to people, and how important it is to be consistent in all the way through that continuum of care that we're providing people. So I think that was a really big one for us as the clinicians kind of providing support for people. I think from the other multidisciplinary team members who were involved in the project, I heard lots of the time people saying, I've never really spoken to somebody about their treatment before, and heard from them kind of what it felt like and the impact that, perhaps environmental factors around the waiting rooms of areas, or how certain things are provided within terms of information, whether that's written information or online information. So just the experience for members of our team to actually sit down in the same room as peers with people and talk about how things made us feel was a really empowering and kind of eye-opening experience for everybody involved. And then I think having kind of talked to people who had gone through treatment and were involved in the process as well, they just said how brilliant it was to be with other people as kind of peers, in terms of not only just people who had also gone through the same kind of treatment as them, and just hearing actually how their experience was the same or different to somebody else's. They said they found that a really therapeutic and kind of healing process in one way, and they also really valued that this was not a kind of tokenistic experience. So we were really in those co-design groups and in those working parties as peers when we were looking at how we can improve and develop our. So I think there were so many benefits on kind of both sides.
It sounds like there was a real kind of cultural shift in the way that you were working with people on making some of those improvements. And that is something that we see with EBCD, that there are some improvements that are made, some changes that are designed together, staff, patients, service users and other stakeholders who are involved. But there's something broader that around the cultural shift that takes place. It's a different way of working, and it should feel different to a lot of the involvement work that we do. I wonder, Sinead, before I come to Juliet, whether there's an example of something that you did change as a result of that project, maybe just one or two examples.
Yeah, absolutely agree with you. I think there has really been that kind of shift in actually how we sort of really think about and value the idea of co-production being really central to how we now think about how we now affect sort of any change within the department. I think there were two sort of areas which are interrelated, but certainly one of the first ones. So out of the co-design work, there were three main areas that people really wanted to work on together, and that was around kind of knowledge provision, advocacy, and mental and physical well-being. And actually, in terms of the knowledge provision and advocacy parts of the co-design work that we did, there was work that really shaped out of that the provision of information and knowledge. So, for example, and I've kind of spoken about it a few times, but the provision of information from pre-treat through that continuum of care wasn't always consistent. And I think hearing people talk about their experience of that was really eye-opening for us, and that was one of the things that has really changed. So we've really tried to look at how we can make sure that the support, the information and the knowledge provision that is being provided is consistent across different staff members and in different situations as well, so that people who are coming to a very traumatic experience, having a diagnosis of cancer and then going through this with a good outcome, but nevertheless a really hard point in their lives, that actually what they're provided with is a consistent level of support and knowledge as much as it can be across all of the members of the team that they meet. So that was definitely one that came out of it. And the other one was actually our kind of understanding and knowledge that everybody is an individual and seeks knowledge and information in different ways, and actually we should be providing that information in different ways. So we actually one of the big things that came out of the project was something that we've called an interactive infographic, and that is a tool which has both videos, written information, and links to different kind of useful websites and places where people can go for more provision and more things that they can either have support from the clinicians to access, or if they want to sort of go and have a look at that kind of bank of resources at a different time, they have the access to that. We also acknowledge that not everybody's going to want that kind of interactive nature of some kind of online, and that in terms of thinking about digital literacy, we wanted to be aware of that as well. So we've also got which are available in print and in different formats for people. But it was this acknowledgement that actually we need to think about actually how does this person want to approach their own kind of knowledge base and increasing their knowledge base, and that's going to be different for each person, and we need to provide a resource which is going to be able to support all of those people within that. So those, I think, were things that came out of it and have really been exciting to kind of develop. And I would also say that the work from this project has, since we did the kind of co-design groups, and we had a really lovely celebration event at the end to kind of talk about where we got to, but actually there was no sort of end to it, because even since then there's other events that are being planned and other people who are kind of coming in as people who have experience of treatment to come and support with this work moving forward. So it's just such a lovely thing to be a part of.
Thank you. Two brilliant examples, but also I can really hear the energy around the project. And I've spoken to you about the project previously, obviously, and that just comes through. And we often do find that when people work in this way, it can be extremely energizing for staff and service users to work in partnership in this way. What's also always fascinating to me is that people can have worked on, say, a particular service for years, and it's only through a project, a co-production project, or through working in a way that takes a sort of co-production approach, that you start to see some of the things that were maybe previously blind spots. So you talked about the surprise when you kind of discovered that the experience for people of the information that they were receiving and when they were receiving it was a surprise to you. That wasn't what you were necessarily expecting. And I think that's the power, isn't it, of co-production, of working in that way. You see things that you maybe wouldn't otherwise see.
Yeah, I definitely, I totally agree. And I think sometimes it can be, and I definitely think as a group of, doctors, nurses, speech therapists, dietitians, we had ideas about what people might ask for or what they might say, and that actually there was a little bit of reticence about, oh goodness, what are people going to ask for? They're going to ask for things that cost loads of money and that we're not going to be able to give them. And there was this idea that actually, if we kind of invite people to say, we want you to help us improve our service and what we're providing you, there might be lots of things that come up that, we can't give those things to you. But actually that absolutely wasn't the case at all. And actually being able to talk as kind of peers in an environment, and nobody is unaware of the stresses and strains that are in the NHS in particular at the moment, but actually as what we were able to put in place a lot of the time was quite small changes which have made a real difference to people's experiences.
That's brilliant. Thank you, Sinead. Juliet, I know that your approach was more broadly to bring a community together to some of the challenges that it faced. I wonder if you tell us a little bit about that. How did you go about it? What was it you did, and the approach that you took?
Yeah, sure. So I was very lucky to be gifted 6 months of time through a Humanising Care Fellowship with the Point of Care Foundation, and that allowed me to do some work in an area that I felt really strongly about. And it wasn't a structured EBCD project in the same way that Sinead was, but a lot of the principles that Sinead was trying to enact in her project are also the same, just loads of similarities. So I was working with a group of maternity, I guess people from the maternity community in the broadest sense. So the work that I was doing was looking at the experience of student midwives who were coming through their education and into practice I was particularly interested in what we might do to help sustain a spark, a student midwife spark. So you might recognise a spark in your work. It's the kind of thing that keeps you going and keeps you excited and interested in your job. And obviously we don't get that spark every day, but it is fundamentally that, you know, what has got us interested in the things that we are interested in. And we know that student midwives with a really strong drive, or some might call it calling or a spark for the profession. And then we also know that oftentimes that gets dulled somewhat during the process of going through their training, and particularly when they face the reality of clinical practice during their placements. We're all very aware of the strains and crisis that the maternity services are under in the UK at the moment, and that's really exacerbating that experience for student midwives. It's a very difficult place to be. So what I wanted to do was really work with a group of students, but also with those who have decision-making power, so people who worked in policy and other people who support students in practice and in universities, to try and work out what we could all be doing better to support students to kind of keep that spark going, because it's so valuable, not just for the students, but also the way in which they bring energy and enthusiasm into the workplace and for their colleagues. That it's kind of the interest of everybody to be able to maintain that and keep people going and keep people retained in the profession as they move into the first few years of their practice, when we know that many newly qualified midwives are currently leaving. So I could have done that in a sort of traditional researchy kind of way. I could have gone around and interviewed some students, I guess. And it was interesting, Sinead, I was thinking when you were talking about how my job as a researcher has often been acting as a mediator between services and patients. So I've gone and interviewed patients or about their experiences of services, and then kind of gone back to the services and said, hey, this is what they told us, this is what they'd like. And what you did, and I guess what I was trying to do, was break down that mediator role and have it be a facilitator instead of an interviewer. So I pulled together a group of students and educators and policymakers so that we could work together. And that also gave the students, of course, in this situation, that the improvements or the changes are aimed at the students, not at the patients, but it's a similar power dynamic, a similar hierarchy that they're working and are existing within. So I was really trying to kind of start to break down that hierarchy by bringing everybody together in a room and setting up the project on kind of fairly egalitarian principles, like what can we do to think about power and how power traditionally but what can we do to try and break that down a little bit and make it a space where everybody has everybody's valued and everybody has expertise. Do you want me to say a bit more about that?
Well, no, it was just fascinating. Actually, I was thinking about the some of the reasons why those power dynamics exist and what maybe stops you from being able to break it down. You know, what are the challenges around breaking down the power dynamics? Because actually to do co-design, co-production well, we need to level the playing field. We need to work in partnership. Yes, we have different roles to play. Yes, you know, we're not doing the same thing and we don't have the same roles, but we are wanting to work very much in partnership. So yeah, I'm interested in maybe some of the barriers, but also what helped to break that down so that you could work collaboratively, could work in that co-production way.
Yeah, I think this is just such a challenge, isn't it? Because culture is very powerful. And also when you're working in health services, you're working within a very hierarchical culture traditionally, and it's very difficult to break that down. I think the advantage of my project was that we were doing it outside of the service. So we were coming into the room without our uniforms on or without name labels, and a lot of people weren't known to each other before they came. So that really helped in my case to be able to start with a level playing field, because we were just like, okay, everyone's just a person in this space. In Sinead's context, or if you're working within a service, you're not starting from that position, you're starting from a pre-existing set of relationships. And that can be a real challenge. And that's something we're facing in the project that I work on now, the Cares Well project, because we're going to be facilitating co-design and co-production with trusts, but they're going to be doing that within that pre-existing set of relationships. So it's tricky. So I think what I tried to do was be really explicit about it. Actually, we talked about power within the group, and we also spent some time kind of collectively coming up with some values for the project. I've done this a couple of times before with projects, and I am at times a bit cynical about the value of values within a workplace, but I have to say within a project it's actually been quite useful, not for the end result of the values necessarily, but the process of talking about what principles we're kind of working with when we're doing the project. So principles of collaboration and principles of equality, and then there will be others. But just having that conversation kind of brings those sorts of issues to the surface and enables us to talk it through. And I guess also facilitating everybody to be able to speak within a space, especially for the students, because obviously they are in effect at the bottom of the hierarchy, even though they're also the most important people in the room. So in that case, it was kind of making sure that they had the space and they were facilitated to be able to contribute right from the start to the project. And luckily, you know, I was really supported with that by the other people, the kind of more senior people in the room were also very much on board with that, which helped. But I think just being very mindful of it and kind of surfacing all of that makes it kind of gives you a good starting point, I guess.
Yeah, I love that. I love that kind of being explicit about it. And I think there's something in that kind of, as you're talking about the values, you are talking openly, transparently about the fact that there are power dynamics at play. You know, you're not kind of making a pretense of the fact that there aren't, and that there's an intention there to work together and level some of that out so that you can work together as peers. I think that was the word that you were using, Sinead.
Yeah.
And Sinead, you were nodding as Juliet was talking about facilitating that space. It's something facilitation is something we talk about a lot in the context of co-design and co-production at Picker, because to be able to have those conversations and to get people working together, collaborating with that sense of equal partnership does require some skill, depending on the context you're in. Is that something you found as well, Sinead, with your project?
Definitely. I mean, it really speaks to me what you were just saying, Juliet. And I think, interestingly, you're right. There's so many of those, because we had, you know, people who had treatment with the doctors who were involved in the project. So, you know, there was, in terms of kind of, you were the person who cured my cancer, you know, there's a big power dynamic happening there. And I think the kind of, you're completely right in terms of the facilitation of those kind of or thinking about that, actually being really explicit and acknowledging actually what the aims and the point of the project was at each point, I found really, really helpful. So to kind of set out the scene of why we're doing this, what people have said to us, which is important, and what we want to do as a group here today was really useful. I also think we did certainly the co-design work, the joint events and the co-design work outside of the hospital. So we did it in a space which was kind of neutral really for everybody, and nobody was there in uniform. So I think, again, not that obviously the doctors don't wear uniform, but they, you know, they were even there in their kind of casuals, if you like, as well. And I think, and I purposely, when people kind of came into the room, I didn't have name cards, but I certainly had said to a couple of the people I knew who'd had treatment, oh, why don't you sit on this table? I'm going to kind of direct with a coffee a couple of other people, you know, different members of staff over to your table, because I really wanted to kind of break down any of those barriers of staff all sitting together or sitting next to someone you knew, because those conversations are going to be different if you do. So there was a bit of facilitation from that point of view. And then I think you're right, kind of being able to facilitate and kind of notice when, if somebody wants to say something, a way of trying to bring them in, not shut other people down, but kind of make sure that there's this acknowledgement that everybody's got a voice here. And I definitely, this is probably something again we'll talk about, but in terms of the EBCD training that I received from the Point of Care Foundation, that, you know, the development of those facilitation skills was something that you guys touched upon within that as well, that I found really useful to just start thinking about how you might facilitate some of those group interactions.
That's brilliant. Thank you, Sinead. Juliet, did you want to add to that?
I did. I was just thinking a lot of what this is about, I mean, definitely for my project, was that the value of the project was in the process as well as in the end results, that I wanted the experience of being part of the project to be valuable to the people who took part, not just in the outcome of it. And, you know, I've spent a lot of time in my life asking people to tell me stories, and often those stories, because they are about birth and about death, are often quite quite emotionally laden, in some cases traumatic, and as a researcher we spend a lot of time thinking about how we can make that experience as comfortable for people as possible and as accessible. But what happens with those stories is often, to a certain extent, out of our control, because what people do with the evidence that we provide is not down to us, although they're to help kind of facilitate impact. But what I love about this process is that it helps to establish the kind of optimize the potential of having a positive impact from the start, both in terms of the outcome, because you're working with the people who are going to make the impact in the end, the policymakers or the educators and so on, but also because you're creating a positive impact in the process. So for the people that worked, the students, for example, suddenly they were in a room, or they were virtual and then real life room with people who are quite senior, have an informal chat with, and they've suddenly got that kind of networking opportunities, or they were exposed to trying out research methods and having a go with that in a way that they might not otherwise be able to do. So that was one of the things that was really important to me, was that they had value in the experience of going through the process, and working to kind of empower them to take ownership of the project. So some of the students went and presented about the project at a conference off their own back, and that was fine by me. That is your project, and others wrote blogs and so on about the project. So it was really kind of me sort of gifting them the authority. I mean, it shouldn't be a process of gifting, but inevitably it kind of is, because power still exists, but really kind of facilitating them to take ownership of it, and to learn from that too.
But the fact that they did that speaks to the sense of ownership that they must have had, and it's those sorts of impacts that you're talking about that I think are so interesting, and quite often not necessarily talked about or thought of when we think about a co-production project. We're thinking about what are the outcomes going to be, what be of it, and it's those sorts of impacts that you're describing, of being part of the process and of working in that way, that are perhaps much harder to quantify, but are so important, part of that cultural shift again, isn't it? Thank you, Juliet. A slightly different question for you, Juliet, around for your project. Was there anything that you maybe would have done differently if you were going to do it again? I don't know if you have examples of things that maybe didn't go to plan, or if there was just learnings that you thought, oh, if I had that time again, I'd do that, or I wouldn't do that.
Yeah, absolutely. I mean, I think the biggest thing was probably about the support that I had in place around implementing the kind of the findings of the project. I think it's an easy pit to fall into. I'm trying to think of the metaphor, but where you spend a lot of energy in the beginning part and in the planning and in the process, and then the end bit often gets a bit lost because you've run out of time or resources. And with a short project, and me going back to a busy day job, I think what I would do again if I was doing it again would be to pay much more attention from the beginning to the end before I got there, and to make sure that there was kind of support from the organisation that I was working within to kind of enable me to have more of an impact at the end. And I think that's probably a lesson for everybody who's involved in any kind of project like this, but is that you really need to be thinking about all stages of the project right from the very beginning. So I think that was probably the biggest thing. It was just the reality of life always hits people.
It always does, and it can be hard, can't it, especially with a co-production, or certainly a process like experience-based co-design. We know that a lot of the time you don't necessarily know what's going to come out of it, because that's what you discover as you work in partnership, to understand what the issues are, what the priorities are, and then to start designing some of the solutions. So, but absolutely that principle of like thinking beyond the immediate is a useful tip.
Yeah, I think this type of working really requires a lot of comfort with uncertainty, which I know is easier for some people than others. And I think it's probably one thing to be aware of before you start, that if you really like things to be kind of completely planned out and sewn up, then this might be a tricky method for you. But it's the kind of pleasure in it for me, and I guess for some people is that flexibility and uncertainty, but it doesn't make it very easy. Makes it fun and impactful, which is also important.
Well, it requires us to really work with people, with human beings are never completely straightforward, are we? So you have to be prepared for that. You're absolutely right.
Yeah, and you're learning from them because you make assumptions about what you think is the right thing, but inevitably and brilliantly you discover that you were completely wrong, which is exactly why we would do this and not do something else. So that is exactly what you want to find out.
Definitely having that element of, you know, being slightly terrified as a discussion kind of starts, or not at the start, perhaps maybe at the start I kind of had an idea of where it was going, and there was always a point somewhere during the day where I thought, oh my goodness, I'm not quite sure where this is going to end up, and things might be heading in all sorts of chaotic directions, but actually back together and there would be outcomes and actions from it. So I felt like I did that lovely roller coaster throughout the entire project, but actually different parts of the journey as well. Just to kind of pick up on what you were saying, Juliet, there about kind of things to kind of think about or considering. One of the things that I think, again, I got out of the training was around kind of setting some timelines within the project. And somebody said to me at one point, set a date for your celebration event at the end. Set that date. Don't be completely unrealistic, but be optimistic about it and set that date that it's going to happen. And I was a bit kind of, I don't know, but I did do that, and it did really help me actually, because when I had that date in mind, I thought, well, I've got to get some really good stakeholders in the room for this. And so I plucked up the courage to kind of email our COO and get some bodies in the room who had, just like you were saying, people who had the experience of being part of the pathway and experience the pathway, but also some other stakeholders who those people might not have met on other occasions, to really understand why this kind of work and experience was important. So yeah, definitely having an idea of be flexible, but having an idea of what the timelines you want to try and reach is really important.
And I think that's where having a method can really help you, because it forces you to stay accountable, to follow a process, and to work towards something. And, as you say, set deadlines, set milestones, rather than perhaps just starting and seeing where you're going. And I know, Sinead, you used experience-based co-design, as you've mentioned. What was it about that methodology that made you want to use it for your particular project?
I think, I'd heard a little bit about it, and actually there were members of my team who had been involved in other EBCD work in different kind of guises. And I just thought it was a really interesting idea that actually, we've talked a bit about power dynamics and kind of the natural kind of bias there is of, a clinician telling the patient what should be happening. And I was really interested in how EBCD really speaks to that idea of actually people's experiences are the things that shape us, and how we can learn and improve things from understanding people's feelings and experiences of something. And the idea that actually the clinicians and the staff, clinical and non-clinical, and the people who are having treatment, having services delivering to them in whatever guise that is, are kind of they both have experiences within that. So we're not just saying it's the patient who has the experience or the person who has treatment has experience. We're acknowledging that there's experiences across everybody, because we're all humans. We're all we're all having those same moments of joy and that kind of spark you were talking about, Juliet, and we're also all having those moments of frustration or anger, or about not being able to deliver something, or not being able to have something. So I think when I heard about the idea of actually, if we can learn from people's experiences about how we can shape and improve services, it really kind of spoke to me that it was this really good way of kind of trying to recognize where some of those power dynamics lie, and how we might be able to work with them to to really help our services move forward.
That's brilliant. And obviously the EBCD training courses run online and in person. You did the online course, I think.
No, I did in person actually.
You did in person,
yeah,
sorry.
Yeah. No,
how did you find it?
I mean, I loved it. I found it was so interesting, because actually one of the things was just the different backgrounds that people came to the course from. So, in terms of working in healthcare, or working in social care, or working in completely different fields that I really had no kind of knowledge or idea about. So just hearing people people talk about how they might use this kind of work, or this kind of method, sorry, you know, with the people that they were kind of interacting with on a day-to-day, I just found really, really fascinating. And there was a lot that I got just from that, from just talking on the day. And I'm sure the online courses are the same, because you get that same experience of networking with the same group of people over a period of time. So that was just really kind of inspirational, really, to hear how people were considering you know, a kind of problem perhaps, or a difficulty they had with their services, or a way that they wanted to prove something, and how this kind of way of working might speak to it. And then, as I kind of touched upon, I think just the laying out of that method in terms of the, you know, you said it, the milestones, the timelines of how you might approach getting a group of stakeholders together, thinking about who are the people that are your priorities for kind of getting involved, bringing those groups together to try and come up with some ideas and priorities for change. It was and an important part, the celebration at the end. You know, it was just really useful to have a kind of set out process and almost kind of template to follow, and the idea that there was lots of flexibility within that, but there was a really clear methodology that you could follow.
And that's really interesting as well, that you drew inspiration from others who were on the training, on the course that you did with you, because as you say, people apply it in all sorts of contexts. And obviously we're talking about co-production in a health setting today, but what we quite often find, we host an experience-based co-design community of practice. So people from globally, from around the world, who are using it in all sorts of different contexts, is once you start to take a co-design or co-production approach, you almost start to see it everywhere in your whole life, whether that's in an education setting or a work setting or home setting. It's anytime you see an issue, a complexity, a problem to be solved, you start to look at things differently and apply that kind of co-design, co-production approach, the importance of and benefits to approaching something together. Thank you, Sinead. I just wanted to ask one final question to you both. What would you say you have learned from taking a co-design, co-production approach that you would want to take forward into future work? You've touched on this a little bit already, but perhaps if there's something or a couple of things that you would want to take forward, having done some form of co-production. Sinead, do you want to go first?
Yeah, I mean, I think like you say, I've already maybe touched on it, but it's just so embedded really in the way that we work as a team now, kind of going forward. And when we think about doing something, it's the kind of first approach that we have, that actually this has got to be co-produced with the people who are experiencing it, because actually there is so much more meaning in that. And I think the sustainability of it moving forward is just implicit then within what we're producing. And I suppose for me it's just going back to that idea of when we're using people's experiences and we're thinking about that being the way that we help improve services, we're really thinking about it in a way of actually what's it like going through this rather than servicing it. And I think, you know, really thinking about it from the person rather than the system has been a big change for us, and something that I just think really kind of, it sits really well for me in terms of how I kind of view my work and how I want to view my work.
Wow, thank you. Juliet.
Yeah, I was thinking as well about the way that health services are quite often inadvertently set up to serve themselves and don't optimally serve the people that they're supposed to be serving. And so I think what it's brought for me is a reminder that to always be putting the people at the center of what we do. And I think also the confidence that if you build trusted relationships with people, that they will come with you and they will trust you as well. And then you can take them with you on this journey to kind of just work together in a collaborative way. And I think that was a real confidence builder for me in doing that with this project, that this group of people trusted an idea that I had, and I trusted them to work with me in doing that. And it really changed I guess my feelings of where expertise lies, that, you know, that the expertise was really with them, especially in a situation where I don't have a background in education. It's not actually where I've worked within the maternity services. They knew a whole lot more about this than I did, and the value in that is really powerful. So it's definitely something that I've brought into the project that I'm working on now, and the work that I do, particularly in that project around kind of engaging with the partners that we're collaborating with, and kind of creating spaces for them to learn and to contribute, most importantly to contribute their expertise and share it with us as academics. So.
What an important note to end on. It's something that we perhaps haven't talked about explicitly so far in our conversations, but to end on the importance of trust and relationship being at the heart of working in a way of co-production, doing co-production, is so crucial, isn't it? Sorry, I thought you were going to say something, then you were going to cough. Thank you both so much. That is all we've got time for, but thank you for talking to us during co-production week. I'm Naomi, I'm the Learning and Development Lead at PICA, and you can get in touch with us via our website if you'd like to find out more about the training and support that we offer. And if you're interested in attending an EBCD course, we run online and in-person courses which you can sign up for on our website. That's all for now. Thank you so much for joining us during co-production week.